Thyroid cancer. Understanding the types, recognizing the symptoms, and navigating treatment. Welcome back to HealthSphere. Today we're focusing on thyroid cancer, a disease that affects the thyroid gland, a butterfly-shaped organ located at the base of your neck. While a diagnosis of cancer can be frightening, thyroid cancer is often highly treatable, especially when detected early. Understanding the different types, being aware of potential symptoms, and knowing the available treatment options are key to a positive outcome. The thyroid gland plays a crucial role in our bodies, producing hormones that regulate metabolism, heart rate, blood pressure, and body temperature. When cells in the thyroid gland grow uncontrollably, they can form a tumor, which may be cancerous. A look at the different types of thyroid cancer. Thyroid cancer is classified into several types based on the type of cell in the thyroid gland, where the cancer originates, and how the cells look under a microscope. The vast majority of thyroid cancers fall into the category of differentiated thyroid carcinomas, which tend to grow slowly and have a good prognosis. The four main types of thyroid cancer are papillary thyroid cancer. This is the most common type, accounting for about 70% to 80% of all thyroid cancer cases. Papillary carcinoma originates from the follicular cells, which produce and store thyroid hormones. It often grows slowly and typically affects individuals between the ages of 30 and 50, although it can occur at any age. Papillary cancer frequently spreads to the lymph nodes in the neck, but even with lymph node involvement, the prognosis is usually excellent with appropriate treatment. There are also several subtypes of papillary thyroid cancer, some of which may be more aggressive than the typical form. Follicular thyroid cancer. This is the second most common type of differentiated thyroid cancer. It's making up about 10% to 15% of cases. Like papillary cancer, it arises from follicular cells. Follicular cancer is more common in older individuals. Typically over 50, it is less likely to spread to nearby lymph nodes, but has a higher tendency than papillary cancer to spread through the bloodstream to distant organs, such as the lungs and bones. A subtype of follicular thyroid cancer is Hürthle cell carcinoma, which was previously considered a variant of follicular cancer, but is now often classified separately due to its distinct characteristics and potentially more aggressive behavior. Medullary thyroid cancer. This is a less common type, accounting for about 4% of thyroid cancer cases. TC originates from the parafollicular cells of the thyroid gland, which produce the hormone calcitonin. TC can occur sporadically or be hereditary, often associated with a genetic mutation in the RET gene. Hereditary MTC can occur as part of a genetic syndrome called multiple endocrine neoplasia type 2. MTC is more likely to spread to lymph nodes and distant organs compared to differentiated thyroid cancers. Treatment and monitoring for MTC differ from those for papillary and follicular thyroid cancers, and genetic testing for the RET gene is important for all MTC patients and their families. Anaplastic thyroid cancer. This is the rarest and most aggressive type of thyroid cancer, representing about 1% to 2% of cases. Anaplastic carcinoma is an undifferentiated cancer, meaning the cancer cells look very abnormal under a microscope and do not resemble normal thyroid cells. It grows and spreads very rapidly into the neck and two distant sites. Anaplastic thyroid cancer typically occurs in older individuals, usually over 60. Due to its aggressive nature, it is often challenging to treat, although advancements in targeted therapy and immunotherapy are showing some promise. Besides these main types, other very rare cancers can occur in the thyroid, such as thyroid lymphoma and sarcoma. Recognizing the signs, symptoms of thyroid cancer in its early stages. Thyroid cancer often doesn't cause any noticeable symptoms. As the tumor grows, the most common symptom is the appearance of a lump or swelling in the neck. However, it's important to remember that thyroid nodules are very common, and the vast majority are benign. If thyroid cancer does cause symptoms, they may include a lump or swelling in the front of the neck. This is usually painless and is often the first sign. The lump may be felt through the skin and can sometimes be seen. Changes in voice, hoarseness, or other voice changes can occur if the tumor presses on the nerve that controls the vocal cords. Difficulty swallowing. If the tumor is large enough to press on the esophagus, it can make swallowing difficult or feel like something is stuck in the throat. Difficulty breathing. In rare cases, a large tumor can press on the trachea, causing shortness of breath or noisy breathing. Pain in the neck or throat. Pain is not a typical early symptom, but it can occur as the cancer grows, sometimes radiating up to the ears. Swollen lymph nodes in the neck. If the cancer has spread to nearby lymph nodes, they may become enlarged and palpable. Less common or specific symptoms, particularly associated with medullary thyroid cancer, can include flushing and diarrhea due to the production of excess hormones by the cancerous C cells. If you notice a lump in your neck or experience any of these persistent symptoms, it's important to see a doctor for evaluation. While most neck lumps are not cancer, a thorough examination and necessary tests are crucial for an accurate diagnosis. Navigating treatment. Options for thyroid cancer. The treatment plan for thyroid cancer is highly individualized and depends on the type and stage of the cancer, the patient's age and overall health, and their preferences. Fortunately, for the most common types of thyroid cancer, the prognosis is generally very good with appropriate treatment. The primary treatment modalities for thyroid cancer include surgery. This is the most common initial treatment for most types of thyroid cancer. The goal of surgery is to remove the cancerous tumor in all or part of the thyroid gland. The extent of surgery depends on the size and type of the tumor, whether it has spread to nearby lymph nodes, and the patient's overall health. Total thyroidectomy. This involves removing the entire thyroid gland. It is often recommended for larger tumors, cancers in both lobes, or when the cancer has spread to nearby lymph nodes. Thyroid lobectomy. This surgery removes only the lobe of the thyroid that contains the cancer, and sometimes the isthmus. This may be an option for small, low-risk papillary or follicular cancers in only one lobe. A potential advantage is that the remaining thyroid tissue may produce enough thyroid hormone, potentially avoiding the need for lifelong thyroid hormone replacement therapy, although this is not always the case. Lymph node dissection. If there is evidence that the cancer has spread to nearby lymph nodes in the neck, these lymph nodes will be removed during the surgery. Surgery for thyroid cancer is typically performed through an incision in the neck. Potential risks include injury to the parathyroid glands and damage to the recurrent laryngeal nerve, which controls the vocal cords, potentially leading to voice changes. Radioactive iodine therapy. This is a type of internal radiation therapy used after surgery for most cases of papillary and follicular thyroid cancer. It involves swallowing a capsule or liquid containing radioactive iodine. Thyroid cells, including cancerous ones, absorb iodine. The radioactive iodine then selectively destroys any remaining thyroid tissue or cancer cells that may not have been removed during surgery or that have spread to distant sites. RAI therapy is highly effective for differentiated thyroid cancers because these cells retain the ability to absorb iodine, unlike most other cells in the body. Anaplastic and medullary thyroid cancers do not typically take up iodine and are therefore not treated with RAI. After RAI therapy, patients need to follow specific radiation safety precautions for a period to limit radiation exposure to others. Side effects are usually temporary and can include neck tenderness, nausea, and changes in taste. Thyroid hormone therapy. After surgery, most patients who have had a total thyroidectomy, and some who have had a lobectomy, will need to take synthetic thyroid hormone pills for the rest of their lives to replace the hormones the thyroid gland normally produces. For differentiated thyroid cancers, thyroid hormone therapy is also often used at a slightly higher dose than needed for simple replacement to suppress the production of thyroid-stimulating hormone by the pituitary gland. TSH can stimulate the growth of any remaining thyroid cancer cells, so suppressing TSH levels helps reduce the risk of the cancer coming back. External beam radiation therapy. This type of radiation therapy uses a machine outside the body to deliver high-energy beams to a specific area. It is not a standard treatment for most differentiated thyroid cancers, but may be used in certain situations, such as for locally advanced disease that cannot be completely removed surgically, or for cancer that has spread to areas like bones and is causing pain. It is also sometimes used in the treatment of medullary and anaplastic thyroid cancers. Chemotherapy. Chemotherapy uses drugs to kill cancer cells throughout the body. It is not commonly used for differentiated thyroid cancers, but may be an option for anaplastic thyroid cancer or for advanced differentiated. Thyroid cancer that does not respond to radioactive iodine therapy or targeted therapy. Targeted therapy. These are newer drugs that target specific molecules or pathways involved in the growth and survival of cancer cells. Targeted therapies are becoming increasingly important in the treatment of advanced or metastatic thyroid cancers, particularly for differentiated thyroid cancers that are no longer responding to radioactive iodine, and for medullary and anaplastic thyroid cancers with specific genetic mutations. Genetic testing of the tumor can help identify potential targets for these therapies. Follow-up care. Regular follow-up is crucial after thyroid cancer treatment to monitor for any signs of recurrence. This typically involves physical examinations, blood tests, including TSH and thyroglobulin levels for differentiated thyroid cancers, or calcitonin and CEA for medullary thyroid cancer, imaging tests. Conclusion. Thyroid cancer is a diverse disease, but the most common types are highly treatable with excellent prognoses. Understanding the different types, being aware of the potential symptoms, knowing the available treatment options are empowering steps. Surgery is the cornerstone of treatment for most thyroid cancers. It's often followed by radioactive iodine therapy for differentiated types. Thyroid hormone therapy is also a crucial part of long-term management. While less common types and advanced disease can be more challenging, ongoing research and advancements in targeted therapy and immunotherapy are offering new hope. If you have any concerns about your thyroid health or notice any suspicious symptoms, don't hesitate to consult your doctor. Early detection and prompt, appropriate treatment are key to a successful outcome in the fight against thyroid cancer. Thank you for joining us on HealthSphere. Stay informed, prioritize your health, and seek professional medical advice for any health concerns. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.